So good afternoon, everybody, and welcome. What a great crowd. Thank you all for coming out. Really appreciate it. So I think many of you should have one of these. You can open that up now if you haven't already. I don't think it's too much of a surprise that it would be a rally towel. Okay, so I think you're going to have a chance to do that a few times today because we have some really cool and wonderful news to share with you. But first, I want to give a really big shout out to special people that are here with us today, and that's all of our colleagues at Jefferson. Jefferson, we welcome you. And before we get rolling, I would like to welcome our government officials and dignitaries. So this might be a continuous clap, okay? You can feel free to do that if you'd like. Representing U.S. Senator Bob Casey is Mariska Van Alst. U.S. Congresswoman Susan Wild. Our state elected officials and representatives, State Senator Nick Miller. I saw Nick here earlier. Representing State Senator Lisa Boscola is Joe Kelly. Representing State Representative Pete Schweier is Sheila Alvarado. We have also with us State Representative Ryan McKenzie, State Representative Zach Mako, State Representative Mike Schlossberg, and State Representative Josh Siegel. Welcome. Our mayors across the region have been great supporters, and at least today we have one of them here. We have Allentown Mayor Matt Turk. Thank you. If I missed Lily or Sal, I apologize. Raise your hand, okay? But thank you for all your generous support. If we've missed any other elected officials, I apologize, but we welcome you here. Thank you for being represented. We really appreciate it. We're really excited to have all of you, but I would be very remiss if I didn't give a very special thanks to the members of the Lehigh Valley Health Network Board of Trustees. To our board chair, John Malloy, our board leadership, and all our trustees, thank you for your dedication and support of LVHN over these many years. Our decision today to join Jefferson is really the culmination of a journey and an exploration that really began 15 years ago with the Affordable Care Act. Our trustees have the collective wisdom and have demonstrated that, experience, strategic vision, and deep understanding of the healthcare environment, and have led us to this fabulous decision to pick the perfect partner, Jefferson. And it is now my honor to introduce the chair of Jefferson's Board of Trustees, Patricia Wellenbach.
Oh, wow, we're in your front row. You don't know what's all back there, up there. Okay, I better up my game a bit. Brian, thank you for this remarkably warm welcome. We got to up our game a little bit in Philly, guys. We'll work on that on the car ride home. So today, Jefferson and Lehigh Valley Health Network begin a journey together. That journey will be transformative for both of our institutions, but more importantly, it will be transformative for the communities that we have served for centuries and will serve together for centuries to come. Our shared values of compassion, collaboration, integrity, and excellence, of doing the right thing, of putting people first, and being bold are what has made each of us the remarkable institutions we are today, and will be foundational to our success in the years to come, our success in what we do for patients and for educating our healthcare workforce of the future. I've served on the Jefferson Board of Trustees for 9 years, 3 as chair. I only have 1 more to go. But my commitment to improving lives through healthcare delivery and education began decades ago because my first career was as a nurse. Let's hear it for the nurses. I think when Jefferson picked their first female board chair, they figured, let's just go with the nurse and have it be brutal and get it over with. But since those early formative days as a newly minted nurse to now, a lot of decades later, my tenure as chair of the board, I have never lost sight of the two things that I believe, and I know we all believe, are essential to every individual regardless of their circumstances. These are the access to the highest in quality of health care and opportunities to advance their lives and the lives of their families through education. Jefferson is presently recognizing 200 years, a historic moment for the institution. And it's been a blast, and we are all grateful to be able to celebrate this milestone of 2 centuries of providing health care and education. But I'm even more excited about what we will do together to keep improving lives, reaching more people, and providing greater access and equity in healthcare, higher education, and advancing research for the transformation of medicine in the future. And so now I get to do a few cool jobs in this role, and one is the thing I'm going to do now, and that is to introduce Dr. Joseph Cashone. Don't get up yet, Joe. 2 years ago, we recruited Joe as the next CEO of Thomas Jefferson University and Jefferson Health. In his short time leading Jefferson, his impact has been remarkable, witness today. He brings the perfect balance of vision, passion, sincerity, humanity, and humility to every aspect of his role as CEO. I can think of no better leader for me to work for and to take the reins to usher in Jefferson's 3rd century, but more importantly, to guide all of us, as we welcome the Lehigh Valley Health Network to our Jefferson family. And so without further ado, I think this is a rally to wave these up and welcome Dr. Joseph Cashone.
I would have picked a different walk-up song. Maybe Welcome to the Jungle, Nick. How's that? No. Well, thank you, Trish, and thank you for the kind words. I do appreciate it. I appreciate the introduction, but more importantly, I really appreciate your unwavering leadership and support to helping us shape the future of healthcare in this region and higher education, as well as insurance. And I'd like to thank our other board members that have come today, Mel Penna and Drew Morrisroe, for their support, and our entire board of directors at Jefferson. They've been instrumental in helping us to manage Jefferson and also help us to get this, this merger, this family connection together. I'd like to also thank our Lehigh colleagues, my colleague Brian Nestor. We've had a lot of tireless time over the last year and a lot of conversations. And I would say, and I said this to Brian earlier, I just want to thank you all for allowing us to bring our 2 families together. And I really do believe that we are 2 families coming together in a way that is different. This is, as Trish mentioned, we are here for our communities, and how our families show up in the communities are so important. And we will have that commitment to this community, we'll have that commitment to the Philadelphia community, we'll have this commitment to the New Jersey communities. I'm grateful that the magnitude of this, this combination is going to be something that will live on for a long time into the next 200 years. It's no secret why we're here. Today, we have the great honor of announcing that our transaction is complete and that we officially are a combined organization this afternoon. The towers. We are now collectively one of the top 15 sized health systems in the country, and one of only a handful that has a national doctoral research university, a health plan that will help us to continue to support our communities, and particularly the most vulnerable parts of our communities. Together, we will offer the communities that we serve the highest quality of care through over 700 sites of care, 32 hospital campuses, and countless associates. The number of associates is more impressive than anything. 65,000 colleagues today, all strong and all part of this family now. That is a lot of concentrated impact that we can make, and our patients and our communities will be the beneficiaries of that impact. Through our combined organizations, those we are privileged to serve will have access to a broader network of nationally ranked specialists who will collaborate, continue to bring groundbreaking technology and treatments close to home. More expansive clinical trials resulting in better treatments for all the communities that we serve, more insurance options providing greater choice for our communities, and more education options. From the beginning of this process, I said that coming together, Brian and I have said this, is that 1 + 1 will equal 3 or 4, or Brian always says 100. And we knew that for many reasons, this is why this had to happen. It was the right thing to do for Pennsylvania and for South New Jersey. Excuse me. Our combination, what is the most striking thing from the first time we met, of what is the shared mission and vision of where we all think healthcare should go. We have similar cultures, all built on the quality of care, safety, and compassion. And the clearest strong between our tie is that goal to improve lives. And I think that is when we knew that this merger was made to happen. Together we'll do remarkable things, but rather than me elaborate further on that, I would like to invite you to watch a short video of what lays ahead for us and what's best for us.
We're coming together. For better. For you. Lehigh Valley Health Network and Jefferson Health are joining together. Two leading health systems shaping the future of care, because our patients deserve no less. We're driven by our shared purpose, to invest in the communities we love, to improve their well-being, and to take on health disparities, so anyone who needs and deserves care gets the right care. We're inspired and determined to unlock the potential of our combined strengths, to make care even better, with more options. By bringing together nationally ranked specialists and advanced technologies through our now expanded health network. By being leaders, not followers, providing innovative care informed by an academic medical center where robust research and clinical trials offer new hope and better treatments for tomorrow. And by breaking down barriers with health insurance plans that provide patients more choices for equitable and affordable care, no matter where they live. Imagine a future where patients have greater access to the specialized care they need, where breakthroughs in research lead to life-saving treatments, and where the communities we love thrive together. When two world-class health systems join forces, they can change the trajectory of healthcare for the better. We start today.
As you can tell, we're not just on the brink of healthcare. We are now creating it. In terms of what's next for us, I just want to acknowledge that change will have a lot of work behind it. And we have, in the months ahead, we'll be working together to make what is the best health system in the region and one of the best systems nationally. Our patients, our students, our beneficiaries will benefit from this, and we will always do what's right for people. This will be a challenge. We'll be forced to think creatively, innovate, collaborate like never before. I know we're up for the task. We have the top talent in this room. We have the top talent across our entire collective system. People like Brian Nestor, I must thank for getting us to this point. Brian, I think Brian emblematic of that commitment to the mission, that commitment to the people, And I just again want to thank Brian. He will now serve as the Chief Operating Officer of the system and will be also continue to be president of the Lehigh Valley Health Network. Brian, it says Dr. Nestor here, but Brian, your partnership and steadfast commitment to the community, to both excellence and to what you've done and been able to help be part of and build here is going to be such a great foundation for our relationship moving into the future. So I'd like to personally and formally welcome you into the family and our family, our collective family. But as part of that, we have a Thomas Jefferson University jersey that is up here somewhere. Oh, there it is. So Brian, I can't welcome you to your own place, but again, welcome to the family. And let's give Brian a huge round of applause with those towels.
Thank you very much. That's very cool. Thank you very much. Terrific gift. And I am really proud to be part of the Jefferson team. You know, getting here today was the result of many, many colleagues working countless hours from LVHN and Jefferson, and I offer my sincere thanks to every single one of them. Thank you. But I do want to acknowledge one colleague in particular with a great story who helped get the ball rolling when it comes to bringing our two organizations together. That colleague is here. It's Lehigh Valley Executive Vice President, Chief Clinical Officer, Dr. Mike Rossi. So Mike and Dr. Cashone have been friends for almost 3 decades. Here are 2 little-known facts that I think you might find interesting. Because of that relationship, Dr. Cashone actually visited LVHN and our cardiac program when he was leading the Heart and Vascular Institute at the Cleveland Clinic many moons ago. So that's an interesting, I remember that visit. Sorry we didn't do business with the Cleveland Clinic at that time, but it was nice to meet you that first time. And then the other one, not so nice. This guy actually tried to recruit Mike away years ago, all right? But I want to let you know, Mike, that as of today, Joe, we no longer hold it against you. Okay? So, Joe, you've been a fabulous partner. Thank you so very much. So, as you can imagine, when we learned that Dr. Cashone was taking on the role of CEO at Jefferson, we were excited because we actually had an insider's view from Dr. Rossi about Joe Cashone's extraordinary leadership journey and how he looked at the future of healthcare. So, we met with Joe early in his tenure at Jefferson, and we immediately recognized that our vision for both our organizations was just so similar. It was just a natural relationship. Conversations took place, the partnership blossomed, and here we are today with hearing Patricia's wonderful words. It has been quite a journey. So thanks, Joe, and thanks, Mike, for that long relationship. At the end of the day, even with patients, it's always about the relationship you build. Sometimes life is all about relationships too, whether it's business or other endeavors. Here at LVHN, our roots are deep. 125 years we're celebrating this year, our history of passion, expertise, innovation. It'll continue vibrantly across Eastern Pennsylvania and within the communities we serve, I promise. Our 5 institutes provide world-class heart and vascular, cancer, orthopedic, neuroscience, and surgical care, and they showcase our focus on collaboration, education, research, and of course, excellence. It's always about excellence here at LVHN. We are the region's only magnet hospital for nursing excellence, a designation we enjoyed for the 5th straight time. Less than 50 organizations globally can say that. We are among the first in the world using the latest robotic-assisted surgery technology from Da Vinci. And we offer the region's only bone marrow and stem cell transplant program. We will continue to grow programs like this and services right here in the backyards of our citizens. You have my word that we will get there and do it even better, because we will be so much better positioned because of joining the Jefferson family. Throughout our history, we've been driven to move healthcare forward and give you and your loved ones access to the quality care everyone deserves and expects and needs right here in their backyard. All care is local. Jefferson has done exactly the same thing. As our Jefferson colleagues celebrate their bicentennial 200 years, we are proud to say that we have been caring in the aggregate together for our communities for 325 years. Amazing. Today we look forward together and we begin to forge the future of healthcare. I know that sounds impossible that two organizations in the Mid-Atlantic states in America could do that, but we really can. When two health systems come together, both nationally recognized by U.S. News and World Report, and they join forces, it creates one strong organization poised to give more access, more expertise, more options, and above all, exceptional care to our patients. This added strength will lead to even more investments in your health as well. New neighborhood hospitals, the Hanover Hill Behavioral Health, our new behavioral health hospital, other new programs that we've been planning for years, and services that are on the horizon. Nothing will change. All these investments will continue as planned. When I joined LVHN in 1998 and then became CEO in 2014, I made a commitment to do everything possible to give people, all people, convenient access to the highest quality care. And today I can tell you that my commitment to you is stronger than ever, and I have a great belief that we will be able to be stronger in this regard. As Chief Operating Officer of the combined organization with oversight for the legacy LVHN, I will oversee operations of all LVHN facilities. This includes our hospitals, health centers, outpatient locations from Lehigh Valley to Pottsville, from Hazleton to Scranton, from East Stroudsburg to Gilbertsville, and everywhere in between. While the benefits of our community are plentiful, this merger also benefits the 23,000 healthcare professionals at LVHN, who I am proud to call my colleagues. We'll offer new educational and growth opportunities for our current clinicians and staff and achieve exceptional recruitment opportunities and assistance from Thomas Jefferson University. This world-class institution remarkably has more than 200 graduate and undergraduate degree programs to choose from. That is a thing to wave a banner. The university is unbelievably strong. We're thrilled to have Susan Aldridge with us today, who leads that enterprise. That will bring tremendous benefit to our employees and our entire community. We're thrilled about that. Colleagues will also have new opportunities for collaboration with other massively skilled physicians and clinicians to expand your clinical knowledge and expertise. And as healthcare continues to rapidly evolve, two leading healthcare organizations will be forging ahead to build the future of healthcare. We are coming together so we can bring more specialists, locations, expertise, research, and education to our patients and communities. We are coming together to give our colleagues more opportunity for growth, professional development, and a fulfilling career in healthcare. Today marks the start of what is the most exciting period, I believe, in the history of healthcare in this region. I am excited to be part of it, and I am humbled to be on your team to help lead our organization through it. And I cannot wait to see what the future holds. Now it is my sincere honor to introduce a nationally recognized and proven healthcare leader who played another critical role in bringing our two organizations together. Please welcome to the podium Jefferson Health President, Dr. Baliyaya.
That's fitting. Thank you, Brian. I appreciate that, and I'm looking forward to our continued partnership. It's really been a pleasure getting to know you and work with you and your team over the last couple months. On behalf of the Jefferson Health family, we couldn't be more excited about our future together. Trish mentioned our 200-year history, which we're incredibly proud of. We've created a legacy of approaching every day with an unwavering commitment to delivering the highest quality care. We've done this by listening to our patients, families, caregivers, and our community. The results have been continuous improvement and innovation that leads to improved patient outcomes. That should sound familiar, as it's the same approach all of you have taken throughout your history at Lehigh Valley. As Joe mentioned, Jefferson Health and Lehigh Valley Health Network have long been like-minded organizations committed to improving community health and well-being. And as we define the future of healthcare together, we share a firm belief in bringing care directly to where it's most needed, putting the patient at the center of their care, and that's truly the future of healthcare. As we address health inequities together, we share a deep commitment to partnering with a broad range of community stakeholders. Our vision is for every individual and family to have an equal opportunity to be healthy. And as we come together, we get to multiply the impact of everything we do, with every patient we touch, every leader we develop, and every study we turn into a better therapy for our patients, and so much more. Think of the power of two organizations committed to excellence coming together. We start today with impressive credentials, regional and nationally ranked in multiple specialties and hospitals, multiple magnet designations, an NCI-designated comprehensive cancer center, care teams that are recognized as top doctors across the country and the region. And now, all of that energy is focused into one united organization. And this is just the beginning. Together, we can leverage our position as a world-class medical institution to recruit the best and brightest clinicians to bring them here to our backyard, while also offering individuals opportunities to advance up the career ladder in healthcare. We can set the course for our team, our community, and care in this region, launch new clinical programs, and tackle some of the most pressing challenges in advancing health equity and building healthier communities. And this clinical excellence lays the foundation and bedrock for academic excellence, which is a perfect moment for me to invite Dr. Susan Aldridge, who is president of Thomas Jefferson University. Dr. Aldridge brings decades of academic leadership to an esteemed university and has already helped demonstrate how powerful it can be to have an aligned, well-regarded, nationally doctoral university with one of the leading healthcare systems in the country. Dr. Aldridge.
Thank you, Dr. Yahia. Today, we focus on our legacy. Jefferson was founded in 1824 as the nation's 5th medical school, the first to open a clinic for the poor and have a teaching hospital so our students could get experiential, hands-on training. And now today, Thomas Jefferson University has evolved to become a nationally ranked doctoral research university and a model of professions-focused education for the nation. We have grown to include 10 colleges, 3 schools, and offer more than 200 undergraduate and graduate programs to more than 8,300 special students. Recognized among the Wall Street Journal's top 50 colleges list, every day we help create the next generation of healers, builders, and creators. Anchored by the esteemed reputation of the Sidney Kimmel Medical College, we attract the best and brightest clinicians and clinicians in training to our region. In fact, more than 130 Lehigh Valley Network clinicians were educated at Jefferson, and I'm sure that more than a few of you are here in the audience with us today as our esteemed alumni. I can't tell you how excited I am about this combination and how today marks a start of a new chapter with increased capacity for our medical students, our nursing students, and all of our students to train here in Lehigh Valley, and for more opportunities for professional development among our colleagues. But I'd like to turn your attention to the screens for a message from Physician-in-Chief of Lehigh Valley Topper Cancer Institute and Thomas Jefferson University alumnus, Dr. Suresh Nair, who will share his perspective.
Since learning that LVHN and Jefferson were coming together, I felt a profound sense of this being a full circle moment for me. This feeling stems from my deep connection to Thomas Jefferson University, where I graduated. Throughout my medical education and career as a medical oncologist, the values instilled in me during my time at Jefferson, along with people who left an impression, have served as important guideposts for my life. However, my journey with Jefferson almost didn't happen. As a high school senior, I had been accepted at several schools and was strongly considering MIT. Despite scholarships, my parents were concerned about the costs, so I explored a pre-med and medical school program jointly offered by Jefferson and Penn State, a program still in place today, where at that time you could earn both your bachelor's and medical degrees in 5 years. I will never forget the day of my interview. At 17, my concerns were less about the interview and more about how I looked. I'd expressed my desire to my dad about getting a new suit, but he did not give in. He said, "Suresh, this isn't a modeling contest. They're picking you for your brains, not your beauty." That day, I learned that SAT scores and high school grades only got candidates in the door for the interview. What truly inspired me was discovering that Jefferson was actually looking for compassion, empathy, and caring in their future physicians. These values resonated with me and were ever present throughout my training. Finding my niche in medicine is certainly thanks to Jefferson. During clinical rotations, I was drawn to internal medicine because I enjoyed getting to know patients, diagnosing and treating them. My interest in pursuing oncology, and specifically melanoma care and research, were sparked by Dr. Michael Mastrangelo, a physician who's still on the Jefferson faculty today. I remember Dr. Mastrangelo as an optimist, especially in his tireless work on melanoma vaccines. When anticipating the future of melanoma care, he once told us, "We are going to crack the code on how to harness the immune system to beat cancer." 40 years later, we see the results of that optimism. Our program at Lehigh Valley Topper Cancer Institute has cured 50 stage 4 melanoma patients. That was an impossible dream back then, but Dr. Mastrangelo knew science would eventually make hope and cure possible. My training led me to 2 health systems, but it was an invitation to join Lehigh Valley Health Network that allowed me to build our melanoma program and become physician chief of Lehigh Valley Topper Cancer Institute. My Jefferson roots undoubtedly made this possible. Reflecting on the journey of my life, I feel immense love and gratitude for Jefferson. My training and career are thanks to Jefferson and a program that took a chance on a high school kid from York County. My inspiration to care for melanoma patients and research new ways to cure them is directly thanks to Jefferson. I believe the final arc of this circle was having the honor to hood my son, Jacob, when he graduated from Thomas Jefferson University last year and he embarked on a family medicine residency. However, now I have a chance to continue forging ahead in partnership with my medical school alma mater. That is truly the stuff of dreams and a full circle moment for me. I often think of my late father and how proud he would be to witness this moment too. Jefferson and LVHN are driven by a shared mission to help people in the communities we serve. Together, we will provide an even greater level of care, including more specialists and more innovative approaches to patient care. We will prioritize discovering new ways to care and cure. We truly are coming together for the future of healthcare, and it's right here in our hometown. As someone who knows how exceptional both organizations are, I'm excited to see the future that Jefferson and LVHN will forge together and how it'll positively impact the lives of generations to come. I can't wait to be part of this remarkable journey.
I'm sorry that Suresh could not be here with us today, but I think you should swing your towels on his behalf today. So, you know, his remarks underscore the incredible synergy that already exists between our stellar organizations and what we're planning to expand and build together in the future to come. At this time, I'd like to invite my colleague, Nick Ragone, Jefferson's Chief Marketing and Communications Officer, to the stage to close us out.
Perfect way to end it. So we have one final surprise before we leave, and thank you. This, by the way, I hope somebody's getting a picture of this. This is amazing. You weren't lying, Trish. That's overwhelming. But so at Thomas Jefferson University, we have a mascot, and he's pretty famous. And we rebranded him this year because that's what marketers do. And so as our guests come up, our speakers come up for our picture. So Joe, Trish, Valley, Susan, Brian, come on up. I want to introduce our mascot, Phil the mascot. I'm assuming he has playing music because here he is, and I think he's going to be giving away some goodies. So let's wave our towels for Phil. And we also have festivities at the Cassich Pavilion in the Healing Garden. So for those of you that don't have to work today, hopefully some of you, come by for some food, festivities, meet your colleagues, and with that, thank you.
Ladies and gentlemen, don't